Welcome to the 2024 Director of Public Health Annual Report. This year's report focuses on healthy ageing and celebrates the fact that West Northamptonshire is a fantastic place to live and grow old. In my report this year, I want to share some of the highlights and the inspiring work that is going on in our local communities. The focus of this report is about how we work together to enhance the quality of life for older adults, addressing health inequalities that some experience and unlocking community resources that support people to live active and healthy lives. Some fabulous things are already going on that we will be able to learn from and build upon to improve the health and well-being of all residents, but particularly of those living in difficult circumstances. Earlier this year, Connect Northamptonshire provided funding for South Northants Volunteer Bureau to do some really innovative work in and around Brackley. This was led by really experienced and skilled workers, well known in their local community. This is one of the areas where our data tells us that we have got an increasing number of older people. So through engagement and local consultation with local people, they come up with a development plan. The consultative approach that they took, the lessons they learned, are something that I'm really keen for us to apply in other areas of West Northamptonshire. I want to also highlight some of the other wonderful examples of where local people have been taking the initiative in helping each other to maintain their health and well-being. At Broadmead Community Church, the Good Champions Cuppa Club provides, in their own words, a friendly, fun meeting place where new friends become old friends. The group have such a friendly, caring approach that one of their members recently had a fall and injured themselves. They got in touch with us and they asked if we could help them to set up a strength and balance exercise session to make sure other members did not have a fall. And now they have a regular group and are looking to expand on the success and popularity of this. I'm also aware of the great work that happens at Renew 88, a self-directed group of people who meet on a weekly basis to chat and to take part in activities and hobbies. This group is also very friendly, very inclusive and supportive of its members, and often has over 30 people attending regularly. One of the joys of my job is that I get to see and hear about a huge number of local initiatives, far more than I can do justice to in this report, but they make me aware of the amazing generosity of spirit and the great talent of many members of our local communities, and I've been keen to see how best we can support these initiatives to grow and thrive. We also recognise the importance of promoting mental health and emotional well-being in the work we're doing, and we've benefited enormously from having the Action for Happiness initiative, which we've been supporting for several years now. This initiative takes into account the findings of recent research about the instrumental role of social and mental well-being as determinants of healthy ageing. And this is why we're keen to see how best to extend the initiative across our local communities and build links with the numerous different community groups in West Northamptonshire. One of the local partnerships that we're most proud of is the one that we have with Northamptonshire Sport. Through this close working relationship, we've been able to set up a network of over 35 Otago-based strength and balance sessions called Get Up and Go. These are delivered in community settings with over 500 people participating in these sessions, and we've had some great feedback about how the sessions have helped local people maintain their quality of life. As a public health team and as a system over the last year, we've been particularly fortunate to work with Samir Gray.
Disease is often complicated by accelerated loss of fitness, deconditioning it's now called, and that's often because other people are making well-intentioned efforts to take it easy and rest, which is completely the wrong thing to say. If you get long-term conditions, you need more activity, not less.
Working with Samir and colleagues in our local partner organisations, we have developed our local call to action. So the message is be active, be physically active as well as keeping our minds active and being socially active. And to coordinate our efforts, we've adopted a network approach that complements our local statutory systems and the ambitions set out in our local health and wellbeing strategy, Live Your Best Life. And this approach emphasises community engagement and co-production, and we've extended our reach to local communities by working with our local professional sports clubs such as Northampton Saints, our rugby club, Northampton Town Football Club and Northampton County Cricket Club as well. So finally, to conclude from me, promoting healthy ageing in West Northamptonshire requires a whole system approach with a concerted effort to address the needs of our growing older population while tackling health inequalities and utilising our fantastic community assets. This year's achievements highlight the progress made in partnership with the voluntary, community and faith sector partners and colleagues from across the wider local system, but a further coordinated focus is required to finally achieve our ambitions. I just wanted to finish by saying a huge thank you to the many partners, organisations and colleagues who work so hard to make West Northamptonshire such a great place to live and to grow older. This report only scratches the surface of the fabulous work underway, so a huge thank you to all those involved.